Think about what a person would do when someone is experiencing a mental health crisis, or when someone is self-medicating with drugs to address physical or psychological pain. Often in those scenarios, it is almost natural that we rely on police or have that individual criminalized for their actions. But why is that individual being criminalized for a behavior that could and should be addressed with the proper care and treatment?
According to the New York State Office of Mental Health, nearly 1 in 5 women and 1 in 10 men entering New York jails has a serious mental illness. And about 3 in 5 people in New York State jails has a substance use disorder.
Albany, New York has one of the largest correctional facilities in the state of New York. In 2020, the average jail population was 424 individuals, according to New York State Division of Criminal Justice Services. Based on a 2015 research report published by Keene and others, 1 in 5 people that are incarcerated suffer with severe mental health issues. Using that data to the average jail population in Albany County, New York, that would be about 85 incarcerated individuals with mental illness.
Overall, jails are ill-equipped to provide quality treatment to people with mental health issues. In fact, studies have shown that incarceration actually exacerbates behavioral health problems. More than 4 out of 5 people in jail who do have mental illness do not receive treatment there.
Mental illness is often not an easy experience for people to deal with. Imagine hearing those thoughts or voices while in the confinement of a prison cell.
Over the years, there have been many attempts to properly rehabilitate people dealing with mental health issues while being incarcerated. Many correctional facilities have had to run trial and error treatment plans to best accommodate their inmates, and we see this in many different forms. For example, the Department of Corrections in Pennsylvania has created a mental health advocate office in 2015 to not only ensure proper care while in prison, but to also provide assistance upon an inmate's release. Some of the plans implemented out-of-cell options, allowing up to 20 hours a week to do recreational activities. Selective housing and classification. All inmates will undergo screening and classification in order to properly house them according to their needs and the amount of attention it requires. And mental health care specific facilities, which means designating certain correctional facilities to the care of inmates' mental health.
In February 2021, Albany County launched a program to place people with mental health issues who are arrested for low-level, nonviolent crimes into treatment programs instead of prison. With the implementation of the Albany Alternative Treatment Court, individuals are linked to long-term mental health treatment and services as an alternative to incarceration. The diversion program is emblemed as an unprecedented milestone for Albany County to shift towards systemic mental health literacy.